glasses all in her foot. I don't even know how that happened, but it happened. So I had to make sure I got every pieces out for her. Alright, so what can I help you with? Are you here for an emergency? Not an emergency. Okay, so you're just here for a regular checkup. Right, let's check you in. Can I have your first name? Alright, and your last. Okay, let's see here. So it says your last exam was almost 3 years ago. You know, you should be coming in every year, right? Yeah, okay. That's totally fine. I'm just going to check you in. My name is Tingles, by the way. It's very, very, very nice to meet you. Alright, so before we get started, I'm just going to need some information here. I need you to fill this out for me. It is just 1 page, really easy, really quick. And then I just need you to sign the bottom here. If you're feeling any symptoms, you can also put it in this box right here. And once you're done, just give this back to me, okay? Alright, thank you. Okay, let's see. Perfect, okay, everything looks good. No symptoms. Alright, have a seat and I'll be right with you. So first we are going to be doing an eye exam, okay? We have to make sure there's nothing wrong with your eyes. If there is, we need to pop them out. Just kidding. Okay, so I'm gonna go ahead and sanitize my hands first. Alright. Okay, I'm going to shine a light, okay? All I need you to do is focus on my finger right here. Perfect. Incoming bright light. Good. Keep focusing on my finger. Alright, that eye is looking a little suspicious. Let me check this eye. Okay, it doesn't seem there's anything wrong with this eye. It's just this one over here. This one right there. I'm gonna get a little closer. Good, okay, yeah. There looks like there's something wrong with that eye actually. Okay, let's do a little color test on you, okay? I have different colors here and I'm gonna hold it up to that eye and I want you to tell me what color you see, okay? Alright, so first color, red. Okay, that was not red. Alright, what about this color? Can you tell me what color this is? Yellow. Okay. Alright, what about this one? This one should be fairly easy. Okay, you didn't get that one either. Alright, no worries. You know what? We'll do an eye chart exam, okay? Alright, so can you cover your eye? This one for me. Perfect, yep, just go like that. Good, okay. Now, can you tell me what letter this is? Okay, can you tell me this letter, okay. Can you read the last row for me, the last row? Okay, yeah, there is definitely something wrong with that eye. Unfortunately, I have good news for you and I have bad news. Which one do you want first? Okay, so bad news, we are going to have to pop that eye out. Yeah, good news is you get to still keep your other eye. I'm no eye doctor, but I think the best bet is to pop that eye out so there's no potential blindness. You know, you don't want to go blind. So I think it's best if we just yank it out, you know? Yeah, but I mean, you'll still be able to see. You'll still have one eyeball right there. Am I right? Yeah, okay. It's okay. It's not that bad. It's not that bad. What is your pain tolerance? Okay, so this this might be a teeny tiny bit painful, just a tiny bit, okay? You should be good though, you should be good. You're in good hands, don't worry. I'm gonna go ahead and sanitize your eyes first, okay? Just that one eye, stay right there. Perfect, okay. Is that burning a little bit? No? Perfect. Alright, so just stay still, okay? Like I said, this might hurt a tiny bit, but you'll be fine. I'm just gonna go in and poke at it a little bit. Yeah, okay. I'm gonna have to cut some of this out. Alright, how are you feeling? Good, good, good. Okay. Alright. Yeah, I'm just trying to cut it so it's a little bit easier to pull out. Right. Right, let me try to get that out. It's there, it just needs a little bit of tugging. Just gotta keep trying to yank it out. Alright, just stay very still. I'm gonna yank it out, okay? Right, 1, 2, and oh, there's your eyeball. How are you feeling? Yeah, you look like you're missing an eyeball. I'm just joking, I'm just joking. Wow, yeah. This is your eyeball. You know, you can see right there. This eyeball, it's gonna stop working very soon. Yeah. I basically saved you from going blind. If you kept this eyeball in your eye, you might have gone blind on both eyes. Yeah. Let's just take a look. It's very, very squishy, your eyeball. Yeah. Alright, well, let me just. Wow. That's a pretty good eyeball. You know what? It's okay. I'm not gonna let this go to waste, you know? If you can't use it, I might as well use it for something. I told you I was on my lunch break before this, right? Yeah, I didn't get to finish because you just came in and I had to stop. So, I'm kind of hungry. You want to try? No? Okay. It says that you have a brain exam. Yeah, your last one was about 3 years ago. You're supposed to get one every year. So we're gonna have to do that today. I need you to just sit back and relax, okay? I'm going to first make an incision right here. Right here. Okay. Just need you to stay very still. This might hurt a tiny bit, but you will be good. Don't forget you are in good hands, okay? Alright. Okay. How was that? That wasn't that bad, right? Okay. Alright, let me just take a closer look. Just next part, you shouldn't feel a thing, okay? Just stay right there, okay? Do not move. Alright, perfect. How are you feeling? Okay, yeah, that's totally normal. Alright, let me just try to get this back. this is your brain. Absolutely fascinating. You know what? Thought it was gonna be a lot bigger, but guess not. So look at the inside of your brain. That is delicious. You know what? I'm gonna have to keep your brain for experiment purposes. Yes, we are going to go and study your brain, so I'm not going to be able to give this back. Yeah. Okay. But don't worry. I'm going to replace something else for you, okay? Here is your replacement. See that brain right there? Perfect. Okay. I'm going to take this out. And wow, look at that. Look at the brain. Brain. It's perfect. It's a little bit smaller, but you know what? Your brain wasn't even that big anyway, so it's really not that big of a difference. Alright, so I'm just gonna stay still. Okay, just stay still for me. I'm going to put that back in there. Okay, I need to make sure it's perfect. Just gonna pinch it around. Maybe rotate it just a bit. Alright, I think that looks good. Okay. Alright, so I am going to help you seal that up, okay? This is not going to hurt. Stay very still. I'm just going to seal that for you. Perfect. Gotta make sure that it is sealed perfectly and sealed shut. Alright. All done. Okay, how are you feeling? Okay, a little groggy. No, that's totally fine. That is very normal. Okay, you are almost done with your annual exam. Okay, so you did lose a lot of blood, okay? Alright, well, I was actually saving this, okay, from my last patient from I think last week. I was saving this for dessert, but you know, I think you definitely needed more than me, and I'm gonna lend you some, alright? So, I don't really know what blood type this is, but you know, it'll work. Alright, let me just take, let me see, I think just cut this part. I'm gonna taste it before I give it to you, just to make sure it's good. Okay. Oh yeah, that's good. Okay, this is perfect for you. It's perfect for you. Alright. Okay, just stay still. Open up. Okay, drink some of that. Good. You need a lot of it, okay? Perfect. How's it tasting? That's a little sweet, right? Okay, perfect. Okay. Alright, that's enough. I need to save this for my dessert later. Before we get started on the next exam, I'm actually going to take your blood pressure. Okay, I'm going to wrap this around your arm. Perfect. Alright, can you relax for me? Relax. Perfect. Relax your arm. Okay. Good. Totally normal. We are going to go and move on to our next time you went to the dentist? Okay, that makes a lot of sense. Okay, well, let's see. I'm gonna try to help just some of that out, okay? Alright, just stay very still. Let's see if this will help. No guarantee. Alright, you know what? I don't think there's any saving. Yeah, I don't think I can save that. I'm no dentist, okay? I'm just a nurse, but I think we need to yank all your teeth out. Okay, here, let me explain. Alright, here we have a model, okay? You see the teeth? It's all white, okay? No infections, no decay, nothing. You see that? Yep, everything is perfect. You have cavities everywhere, and it is starting to go to your gums. Okay, and if I don't yank it out, you're gonna get an infection, and you're just gonna lose all your teeth. So might as well just yank it out now, you know? I'm saving you time and pain. So basically, we're gonna have, this is gonna be you. I'm just going to yank it out. Yeah. The good news is I do have anesthesia for you, so I can just put a little bit right there. You won't feel a thing. Okay. I'm gonna give you this shot. Okay. Alright, open up. I'm just gonna put it right there. Okay, good. Wait a few minutes, okay? Let that set in and you shouldn't feel a thing. My favorite part. Okay. We're gonna go yank them all out, okay? I'm gonna try to do it one by one, but if it's easier, I'm just gonna try to do it all at once, okay? Alright, so need you to just stay very still. Okay, open wide. I'm just gonna try to clamp it and try to yank it out. Really gotta use my muscles. Just stay very still. I'm just gonna try to. There we go. We got the top part. Oh, you look so cute with no teeth. Okay. Alright, let me take a look at this. Yeah, look at your teeth. They're not doing good. You got a chip in this one too. Cavities, yeah. Nope, okay. Gotta help you yank the bottom too, okay? Just stay very still. I'm gonna get in there. I'm gonna try to just yank the bottom for you. Did you feel any pain? No, right? Okay. You shouldn't feel any pain. Just stay very still. Just gonna try to. There we go. Way easier than I thought. Yeah, my last patient I had, it took almost a whole hour. Okay, let's take a look at your teeth. Yep, they're looking a little uneven. Yeah. You know what? You can get some new teeth, because this ain't working for you. Yeah. Alright, so I'm just gonna put that aside right there. You know what? I honestly thought you were gonna look a little funny without teeth, but you actually look cuter without teeth. I think that was your last exam. Yup. You are all done. How are you feeling? You look better than before. Yeah. Okay, so let's see. We gave you an eye exam. Let me just take a look. Okay. Also took your brain and we replaced it, and we also removed all your teeth. Perfect. Alright, so you're all set for your yearly checkup. Make sure you come back next year as well, okay? actually go